Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, we have been talking about role of Pancha Karma in neurological disorders in children. This is the second part. The last class we have seen diagnosis of the given case, anatomical, physiological, etiological diagnosis. Today, we shall try to do the same diagnosis in Ayurveda parameters. Yes, a neurological case was there. Now you have to identify according to Ayurveda in which particular phase it is there. According to Ayurveda, if I am talking, in which particular phase this particular disease is there. Now, identification of this is important, similar to the previous one also. Now Vatakshaya. Now most of the time we believe that neurological means it is Vata, isn't it? All the neurological functions of the body, so they are managed by the Vata. Of course, this sentence is partially true, but Vata is not only related to neurological system. Vata is more beyond than that. Okay, now movement of the movement of the Vata is responsible for movement. Va, Gati, Gandhanayor. We know that. So there is also movement of the air. There is also movement of the fluid in the body. Basically, this movement is also the function of the Vata only, but nervous system is not directly involved there. Not involved there at all. But still it is called as Vata only. Okay. So that we will discuss later. Anyway, so neurological disorders in Ayurveda, first we shall see. When a patient comes to you, you identify these three possibilities. What is that? Whether there is a Vata Kshaya, whether there is Vata Vriddhi, or whether there is Vata Prakopa. Okay. So first, patient is coming to you with Vata Kshaya, suppose. According to contemporary science, it's a neurological disease. But when you see under Ayurveda parameters, you find that there are symptoms of Vata Kshaya. So what Ayurveda says is, Kshaya doshas will not produce any symptoms. But the normal functions of the particular dosha will be get reduced in case of Kshaya. There is no production of other symptoms, extra symptoms. Okay, Kshinaha jahati swalingam. That means pramana and karma of the Vata will going to decrease compared to its normal parameters. Okay, suppose in Vata, the normal function of the Vata is Uksaha. Now, if Vata Kshaya is there, Uksaha Kshaya can be seen in the form of Vishada. This is the example given in the classics. Okay, in case of Uksaha, there will be Vishada. That means Kshinaha Jati Swalingam. So, there is loss of the normal functions of that particular Vata. Okay. So this we have to identify whether the given neurological problem, whether it is Vata Kshaya. For example, in case of autism, a patient of autism come. You can give so many title for that, Ayurveda title for that autism. But if you look into that, it is simply a Vata Kshaya condition. Why I am telling is, Va Gati Gandhana is a normal derivation of the Vata. Gati and Gandhana, these are the two basic properties of Vata. Now what happens in autism is Gandhana property, perception. Okay, perception of the different senses. Sensory perception is get affected. That's the reason, therefore it is called a sensory block, a condition with a sensory block. So it basically autism is nothing but a Vata Kshaya condition. Vata Kshaya condition. Okay, it may be associated with some other comorbidities and all, that's a different issue. Otherwise, for the first look, it is a Vata Kshaya condition. Similarly, you have to see whether the given condition is Vata Vriddhi or not. Second condition, you see Vata Kshaya is over, now Vata Vriddhi. In Vata Vriddhi, what happens? Karma and pramana of the disease both increase. Karma is also increasing, pramana is also increasing. Okay, so when karma increases, normal function of the karma is Vata is a chala, etc. But here there is excess stimulation that leads to excessive functioning of the neurological system, leading to tremors, etc. There may be tremors, there may be seizures, or excessive incoordinated activities, uncontrolled activities, etc. Okay. Similarly, then there is a Vata Vruddhi. One of the Vata Vruddhi is Karsha Kashtoshtam. That means increase your blackish discoloration. Okay. Suppose if you see over functioning of the Vata, neurological system in the brain, so that may lead to the excess production of the melanin, melanocyte producing hormone, okay, which is under the control of pineal gland. So if more function of the Vata is there, stimulation is there, if the pineal gland is producing more, then it may lead to blackish discoloration, dryness of the body sometime. So now, what I mean to say is you have to identify whether it's Vata Kshaya or Vata Vruddhi. Now if you take the example of ADHD, ADHD is basically an Vata Vruddhi. Okay, hyper activity is there, hyper reactive disorder, hyperactivity is there because of overstimulation. Excitatory neurons are stimulating more than the expected level, and there is also loss of concentration. Concentration is basically the work of a kapha. Okay, kapha tamoho niyamaka. Tama and kapha are interrelated. So in ADHD there is increased activity and also decreased concentration. So this decreased concentration is because of decreased kapha, because of relative increase in vata. Okay, so identify whether the given condition is Vata Kshaya or Vata Vruddhi. Third, identify whether the given condition is Vata Prakopa. Yes, it may be Vata Prakopa sometime. It is not Kshaya, Vata Vruddhi. It is going to the next stage, that is Vata Prakopa. In that Vata, you will have some more symptoms. Okay, so you will have some more symptoms. For example, Sanganga, Banga, Sankocha, Varta, Karshana, Tarpanam. These are all the Vata Prakopa Lakshana. Okay, now for example, you take a symptom disease like cerebral palsy. Now, cerebral palsy, you will find Sanga, Angabanga, Sankocha, contractures, deformities, etc. These are all Vata Prakopa Lakshanas. These are all Vata Prakopa Lakshanas. So, when patient comes to you, first identify whether it is Vata Kshaya. Patient of neurological problem comes to you, identify Vata Kshaya, Vata Vruddhi or Vata Prakopa. Then only you can start the Panchakarma treatment. Next, come to the next part. Next, what you have to identify in Ayurveda, the given patient of neurological problems which is coming to you, it may be because of Dhatu Kshayajanya Vata Vyadi, it may be because of Margavarodha Janya Vata Vyadi, it may be because of Dosha Avrta Vata Vyadi, Dhatu Avrta Vata Vyadi, Mishraka Avarana Janya Vata Vyadi, Anyonya Avarana Janya Vata Vyadi, Nanatmaja Vata Vyadi, or Marmabhigata Janya Vata Vyadi. Okay, some trauma is there, some trauma is happening, and because of which the patient has got some neurological problem, it is Marmabhigata Janya Vata Vyadi. Okay, simply excess dryness of the body is there, that may be simple Nanatmaja Vata Vyadi. Nanatmaja, na anatmaja. Nanatmaja means na anatmaja. That means it is only because of pure Vata. Pure Vata. Only Naru problem is there, nothing other is involved. Purely a Naru problem. Then Anyonya Avarana Janya Vyadi, that also we know that we will discuss. So this is a second set of classification that we have to diagnose. First set we have already covered, Vata Kshaya, Vata Vruddhi or Vata Prakopa. Then comes to second set, identify here. Now two basic things we will take here. What is that? One is Margavarodha Janya and Dhatu Kshaya Janya. Later we will go for Avarana. We know that all the Vata Vyadis, we have got two potential causes. Number one is either it is because of the Margavarodha or because of Dhatu Kshaya. Now, when you consider that a neurological problem is Margavarodha Janya, so this is when the presentation is acute, when the acute presentation is there, or when the cause is Santarpanotta Janya, because Margavarodha can be always caused by Santarpanotta causes, maybe Divasapana or any other Prameya Hetus. So they may lead to Santarpanotta. Prameya Hetus, and that is the Prameya Hetu, you know that Divasapana, then Nidra, Navannapana, Gudavaikratasya, all these things. No, acute presentation most of the time, always Margavarodha. For example, you take in paralysis, hemiplegia and all. It is a Margavarodha. isn't it? There is a sudden rupture of the membrane arteries or capillaries, and there is a bleeding outside, leading to obstruction. There may be embolism, there may be thrombosis, there may be edema because of this bleeding and all. So they are all acute presentations. Vascular causes are always acute presentation. Okay. Or sometime Margavaroda may be compared with some of the storage disorders, which is very common in children. Niemann-Pick's disease, cannabis disease, many storage disorders are there. Starting from Wilson's disease even. Okay. Wilson's disease also in the later stage, it will go into copper start collecting in the brain. So metabolic disorders, vascular causes, storage disorders. So most of the time they are all Margavaroda. It is causing compression. Okay, and most of the time it is because of Santarpanotta causes. Now there is abnormal deposition of some of the things which is non-metabolized. So that's the reason why the storage disorders cause the problem in problem of neurological problem. Okay, so they are all considered under the heading of Margavaroda Janya Vyadhis. Now you need to identify before starting the treatment whether this patient is of Margavaroda Janya Vyadhi or not. Next, Dhatukshaya. So when you consider that this patient of neurological problem is Dhatukshaya Janya Vata Vyadhi, yes, if the presentation is very chronic, onset is very slow, and if it is a chronic presentation, then we have to consider that this is a chronic presentation or slow presentation and gradual presentation. And most of the time this is because of apatarpanotta causes. Most of the time it is apatarpanotta causes. For example, in case of cerebral palsy, when birth asphyxia occurs, that asphyxia can occur because of various causes. One of the problem is hypoglycemia. Okay, early neonatal hypoglycemia can cause so many problems of cerebral palsy. That hypoglycemia, that less amount of the glucose, that is apatarpanotta cause. Okay, similarly explanation can be given. Then certain degenerative disorders, many degenerative disorders are there, or demyelination disorders, and spinal muscular atrophy. Okay, so these are all considered under degenerative. That means all these causes are Dhatukshaya Janya Vata Vyadhis or apatarpanotta causes. Okay, now this Dhatukshaya Janya Vyadhi cannot only not confined to the neurological system. Sometimes, for example, you take malnutrition, a patient of malnutrition. Now this is malnutrition is again Dhatukshaya Janya Vyadhi, but it is not related to neurological system. Okay, so that means that Dhatukshaya may be because not only because of this maybe the reason for neurological problem. Dhatukshaya may lead to so many other conditions also. Apatarpana Vyadhis are many. There also this presentation may be there. One of the examples is malnutrition. Malnutrition is Dhatu. Okay. So Kevala Vata Vyadhi, we know that Vatena Janita Asadharana Vyadhi is Vata Vyadhi. Okay. So therefore, this classification is also very important when you consider neurological disorder in Ayurveda. In the next class, we shall see how to identify the neurological problems as for the Ayurveda in terms of Avarana. That we will discuss in the next class. Thank you.